forget to subscribe my channel and also please give your valuable comments. Now friends, as we are knowing, we were discussing about the history taking. Okay, history taking is very important part in the medical field. A proper history taking is very important. Therefore, we are looking at the different facets of history taking in a very detailed way, so that we'll have a clear-cut base and idea regarding the importance of each and every point in the history taking. In the last few classes, we have already discussed about the vital data, as we know. The vital data, one of the point is the socio-economical status. We have discussed that also. That's modified Kupuswamy rating scale is commonly adopted for the medical purpose. So there are so many other scales are also there, and this particular scale will be also revised time to time, and we need to keep update on that. So the scales will be updated by time to time. Anyway, Kashyapa gives a very important aspects regarding the socio-economical status in the Sweda Adhyaya. In the Sweda Adhyaya, he says that he beautifully explains the role of socio-economical status of a patient in the successful treatment of the disease. So he says that the diseases are common for the rich people and also for the poor people or the common people. But sometimes the asadhya disorders even become sadhya in rich people, and sometimes the sadhya disorders are also become asadhya in poor people. The reason what he says is ashana, dhana, and dakshina. Ashana, dravya, and dakshina. So that means the poor are not affordable to many of the medications, whereas rich people can afford it and make it available, and therefore many asadhya disorders also become sadhya, and that makes the difference. In the poor, as they are not able to collect the ashana, dhana, and dakshina, that is the money and as well as medications and as well as the food, they are not able to get the nutritional food, they are not able to afford the medications, okay, and they don't have much money. So these three factors make the difference in rich people and as well as the common people or poor people. So this concept is very clearly explained by Kashyapa. Therefore, he says when you are giving the treatment, you have to look into the socio-economical status of the patient also. Okay, so then again he classifies Durbala, Madhyama, and Uttama like that. So anyway, these are the three important facts which makes the difference in the poor people and rich people. So this is one point which I have missed in the last class. Therefore, I have covered it. Now we come to the main complaints. So this includes main complaints means now we are coming to the history taking proper. So far we are discussing about the vital data. Now in the history taking proper, we have different histories. One is main complaint, another one is history of present illness, history of past illness, history of treatment illness, history of treatment history. Then we have got family history. Then we have got nutritional history. Then we have got developmental history. Then we have got antenatal, postnatal, and perinatal histories. Then we have got nutritional histories. Then comes the personal history. Okay, personal history is there. So like the different aspects of that, we will try to cover one by one in a detailed way. Okay, so first is about the main complaint. So as we know, main complaint is also called a chief complaint. Okay, so main complaint is that complaint for which patient visited the hospital or OPD. Okay, so the complaint or the problem that makes the patient to visit your clinics, and that is called as a main complaint. Okay, so how to write the main complaint? And main complaint, when you write in the case sheet, it should be always written in the patient's words. What patient comes and narrate to you, the same has to be written in the main complaint, and you should not use any of the technical terms or medical terms. That should not be used. Suppose if the patient is telling that doctor, I'm having if that means technical terms should not be used. Suppose the patient is telling that I am suffering from hydrocele, because patient knows something about hydrocele. Okay, now suppose he directly coming, sir, I am complaining of hydrocele. Now you cannot write, although he is telling that, you cannot write the technical words in the main complaint. Technical words or medical terms should not be used in the main complaint. We assume that it should be on patient's words. Okay, so although patient says I am suffering from hydrocele, you should write patient is suffering from swelling in the lower abdominal area or swelling in the groin area. or in the scrotal area. So that much you can write. So I mean to say, when the patient is coming and you know that it is gastritis or some other problems, patient is suffering from gastritis, you cannot like that. You cannot write like that. You should write patient is suffering pain in the epigastric region. This also you should not be written. You should not write this also. Okay, no. So what is the correct way? What the patient is suffering, patient is complaining of pain in the upper part of the abdomen. Okay, this is the main complaint. You know that it may be gastritis, you cannot write it. You know that it is the epigastric area, but you cannot write it. Okay, only patient's word should be used. Patient complains of pain in the lower part of the abdomen. Patient complains of the pain in the lower joints, lower limb joints. Okay, or patient complains of a feeling of vomiting sensation. So these are the main complaints. Or patient complains of a fever. Okay, or increased sensation of heat or fever. So always you should write it in terms of a patient's complaints. What patient exactly come and say, the same word should be written. This is a rule number 1. Okay, you should not use any of the technical terms and medical terms. Now, another one is main complaint should be always written along with the duration. Okay, patient is suffering from fever since last 10 days. Duration should be there. Without duration, main complaint is incomplete. So that should be duration. Patient complains of abdominal pain in the upper part of the abdomen since last 10 days. The duration, total duration should be there. So this is another important rule. Third important rule is, in the main complaint there cannot be more subjective symptoms. Patient complains of weakness. So this is the more subjective symptom. You cannot assess it. So such subjective symptoms should not be given any importance in the main complaint. Okay, patient may have so many complaints and one of them is weakness, and you are giving more importance for weakness. Patient is also complaining of weakness. No, patient is complaining of abdominal pain. Patient is complaining of fever. That is the main complaint. Okay, that means the associated symptoms or more subjective symptoms should not be given more importance in the main complaint. Only those complaints which makes the patient bother more, that should be written. Okay, there should not be any subjective symptoms. Another important thing, when there is more than one main complaint. Now suppose a patient is there and he is telling that he has got fever since last 10 days and vomiting since last 2 days and abdominal pain since last 5 days. Okay, so now you have to write it in a chronological order. When there is more than 3 symptoms are there or 2 symptoms are there, write the main complaint in a chronological order. So what is the chronological order? Patient complaints of fever since last 10 days, patient complaints of abdominal since last 5 days, abdominal pain since last 5 days, and patient complaints of vomiting since last 1 day. Okay, so this is the chronological order. So this order has to be maintained. And any associated symptoms. Now patient is also having fever and patient is also having body pain. Okay, myalgia. So now this associated symptom should not be given more importance than main complaint. So this you have to understand. So therefore we always assume that that means the complaints of the patient which make him bother more, suffer more and tell more when he visit to you, that should be considered as the main complaint. Okay, so this is all about the main rules of writing the main complaint. So now again I will repeat what are the main rules on writing the main complaint. Main complaint contains patient's words. Okay, main complaint should not contain any of the technical or medical terms. Main complaint should be written on patient's words. Same patient complaint should be written. Main complaint should be written with the duration. When there is more than one main complaints, 2 or 3 complaints, main complaint should be given in a chronological order. Again, main complaint should not contain any of the subjective symptoms. Associated symptoms should not be mistaken as main complaints. Okay, so these are some of the important rules when we are writing the main complaint. Okay, so you should not use any medical terms like peptic ulcer. Patient is suffering from peptic ulcer since last 3 months. No, this is wrong. Patient is suffering from hydro since last 10 days. No, this is wrong. Okay, so such medical terms or technical terms should not be there. although patient is knowing about and he is telling that I am suffering from hydrocele, but still in the main complaint you cannot write all those things. Although it is patient's worth, educated patient come to you and say I have got peptic ulcer because he visited many doctors and they diagnosed. But still, as a student, when we are writing, medical student, we are writing the history, main complaint should not contain any of the technical terms. Although patient says that he is suffering from peptic ulcer, you write patient suffering from pain in the upper part of the abdomen. This is the correct way of writing main complaint. And especially when more than 3 complaints are there, chronological order is very important. Okay, see, pain, there is fever, there is pain, there is vomiting. This may be interrelated. So this you come to know when you write in a chronological order. But if you are not writing in a chronological order, you are writing the vomiting first, you are writing the fever next, and then you are writing the abdominal pain, then there is no clue. But if first fever is there, then abdominal pain is there, then vomiting is there, yes, then this itself gives a clue that this may be a case of appendicitis. But if you write it in a episodic manner, non-chronological order, so vomiting started, then you may think vomiting may be because of some other problem. Okay, then he started with the fever, according to your history, there is a fever, and then there is abdominal pain. Now the diagnosis will take another diversion. But when you write in a chronological order, that itself gives a clue and guideline for you for the further questioning of the patients. Okay, so that's all. Therefore main complaint is very important. Okay, so in Ayurveda it is called as Mukhya Vedana. Okay, so main complaint or Mukhya Vedana, and this is a main complaint for which patient visited your institute or your OPD. Thank you very much. Again, subscribe my channel and also please give your valuable comments, and we will meet in another class with the history of present illness, which is very, very important. Thank you very much.